Well, hello there.
If you're getting up multiple times a night to urinate and worrying about what it all means, I get it. I understand exactly how that fear feels. That constant worry, that uncertainty, it can really weigh on you. But what I'm about to share with you is going to completely change how you think about your prostate health.
By the end of this, you will know exactly what to expect during a prostate biopsy, you'll understand how to read and interpret your results, and you'll see why having this knowledge is absolutely crucial for protecting your health for the long haul. So, let's get right into it.
Let's talk about Robert. At 58, Robert was, by all accounts, the picture of health. He was active, ate pretty well, felt strong. He really never imagined that one small, subtle change in his body could become such a huge source of concern.
It really just started with a little thing. A more frequent, more urgent need to use the bathroom, waking up 2 and then 3 times a night. At first, he just shrugged it off, figured it was just part of getting older. But then his annual blood test came back, and his doctor pointed to just one number, his PSA. That stands for prostate-specific antigen, and it was elevated.
That word, biopsy, it just sent a chill down his spine. His doctor recommended one to get a real, definitive answer. Robert agreed, of course. But there was something crucial about the whole procedure, a key piece of information that would have totally changed his experience that nobody bothered to explain to him up front. And we are going to get to exactly what that was.
And that brings us to that first sign of worry for so many men. It's that moment a doctor says, biopsy, and your mind just starts racing with questions and fears. So let's clear up all the confusion right now.
So, you might be wondering, why is a biopsy considered the definitive test, right? Why can't doctors just rely on blood tests or some kind of scan? Well, it's because while other tests can suggest there might be a problem, only a biopsy gives actual proof. It lets a specialist look at the cells themselves, right under a microscope. There's no guesswork.
According to the Mayo Clinic, there are pretty much 4 main reasons a doctor might recommend a biopsy. The most common, by far, is an elevated PSA level in your blood. Another is if your doctor feels a lump or some other kind of abnormality during a digital rectal exam. It's also possible you've had a biopsy before that came back normal, but your PSA levels just keep staying high. That might call for another look. And finally, if a past biopsy found some abnormal cells, not cancerous, but not quite normal either, your doctor's going to want to keep a close eye on them.
Now, here's what most men do not realize. When they hear biopsy, their mind immediately jumps to the risks, the pain, the what-ifs. And look, while there are risks with any medical procedure, the fear is very often way greater than the actual reality. The data tells a much calmer story.
Let's look at the real numbers. This comes from a study published by the U.S. National Library of Medicine. The most common side effect, and about half of men experience this, is just seeing a little blood in the urine. It's typically minor and goes away on its own. Next up is some rectal bleeding, which happens in about a quarter of men. But what about the scary stuff? The risk of a serious infection, the kind that would require a hospital stay. Well, that's less than 5%. So the key takeaway here is that while minor temporary issues are pretty common, the severe complications that so many guys worry about are actually quite rare.
All right, let's pull back the curtain on the procedure itself and just demystify the whole thing. Because knowledge is the enemy of fear. And when you understand exactly what's going to happen, step by step, it puts you right back in the driver's seat.
The prep work is actually pretty straightforward, and every step is there for your safety and comfort. First, you'll talk with your doctor about any medications you're on. You'll probably have to stop taking things like blood thinners for a little while. Second, to prevent any infection, you'll be prescribed some antibiotics to take beforehand. Third, you might be asked to use a cleansing enema at home to, well, prepare the area. And finally, this is important, if you choose to have sedation to help you relax, you absolutely have to arrange for someone to drive you home afterward.
Now, there are 2 main ways this procedure is done. The most common for a long time has been the transrectal biopsy. That's where a very thin needle passes through the wall of the rectum to get to the prostate. But there's a newer method that's gaining popularity called the transperineal biopsy. With this one, the needle goes through the skin of the perineum. That's just the small area of skin between the scrotum and the anus. The big advantage here is that it may have a lower risk of infection since it doesn't have to go through the rectal wall.
So how many samples are they actually taking? Well, it's not just one. The urologist will typically collect between 10 to 12 tiny little cylinder-shaped tissue samples. They're called cores. And doing this just ensures they get a good representative sample from different zones of the prostate, which leads to a much more accurate analysis.
And this brings us back to what Robert's doctor never told him. This is that crucial detail that can make all the difference. You see, research has actually shown that different parts of the prostate have different sensitivities to pain. The most sensitive area is what's called the apex. That's the very tip of the prostate gland. The base of the prostate, on the other hand, is much less sensitive. Now, why does this matter to you? Because knowing this helps you understand the sensations you might feel, and it allows for much better pain management during the procedure. It's the kind of insider knowledge that empowers you.
So, the procedure is over. Now comes the waiting game. But waiting is a whole lot easier when you know what you're actually waiting for. So let's talk about decoding your results. This is where clarity really gives you control.
A little while after your biopsy, you're going to get what's called a pathology report. It sounds very official and complicated, but it's really just the document written by a pathologist. That's a doctor who specializes in looking at tissue samples. They take your little prostate cores, put them under a powerful microscope, and check for any cancer cells.
If they do find cancer, the single most important number on that entire report is called the Gleason score. Now, listen closely. This is not a measure of how much cancer you have. It's a grade of how aggressive the cancer cells look. The score ranges from 6 to 10. And a lower score is good news. It means the cancer cells look a lot like normal cells and are probably going to grow very, very slowly.
Let's break down what these scores really mean. A Gleason score of 6 is considered low grade. A 7 is intermediate or medium grade, and any score from 8 to 10 is considered high grade. That indicates a more aggressive cancer that's likely to grow and potentially spread more quickly. This one number is one of the most critical factors in deciding what comes next, whether it's something like active surveillance for a low-grade cancer or more immediate treatment for a high-grade one.
Okay, so you've got your results. Let's talk about your path to control. Understanding the procedure and the results, that's half the battle. The other half is knowing what to expect afterward and how to confidently manage your own recovery.
Your body needs a little time to heal. It's totally 100% normal to see some blood in your urine or your stool for a few days. It's also very common to see reddish or rust-colored blood in your semen, and just so you know, that can actually last for several weeks. And yeah, you'll probably feel some soreness. It's so important to know that these are all expected signs of your body healing and are not a cause for alarm.
But you also need to know the warning signs. The things that mean you need to pick up the phone and call your doctor right away. If you develop a fever or chills, that could be a sign of infection. Call them. If you have serious trouble urinating, if you experience bleeding that's heavy or just won't stop, or if you have pain that gets worse instead of better, you need to make that call. Think of this as your personal safety checklist.
You know, the fact that you have watched this far says something really important about you. It means you're already taking charge of your health with knowledge instead of fear. You're part of a community of men who don't just ignore their health issues, but face them head-on with information and with courage. You're doing what it takes to protect your future.
And of course, please remember, this is all for educational purposes. It is not a substitute for professional medical advice. You should always speak with your own licensed clinician to make personal medical decisions that are right for you and your specific situation.
Now, I have a question for you, and I really want to know your answer. What was the most surprising thing you learned about this whole process? Was it the low risk of serious complications? Or maybe that detail about the prostate apex? Let me know down in the comments. Sharing your thoughts can really help other men who are going through this. And make sure you subscribe, because in our next deep dive, we are going to explore the absolute truth about testosterone replacement therapy. You will not want to miss that one.